Prime Minister said on Thursday, the objective of this government is to save lives. That's been our objective from the beginning. But more than 28,000 people have now died after testing positive for COVID-19 in the United Kingdom. Only the US and Italy have seen more deaths. I mean, the government's own graph that you've been showing at these press conferences shows that we're on track to actually overtake Italy as well. By your own metric, haven't you failed?
No, I don't agree with that. I mean, the first thing to say is that every death has been an absolute tragedy. I know quite a number of people who've been affected by this disease, as virtually everybody will know people now. But I don't agree with that for a whole variety of reasons. We need to be very, very careful at the way we assess this information, as Professor David Spiegelhalter pointed out in The Guardian this week. Simply looking at that raw data doesn't actually tell you the story. What you need to look at is excess mortalities over a period of time.
Let's look at the excess mortality in that case then, because, as you say, Chris Whitty as well, the Chief Medical Officer, says that's the best way perhaps to look at it. But when you look at excess deaths, that's the number of deaths per week above the normal average, you can see that other countries have had a spike but have fallen. But England's line is far higher and still rising. So even if you look at the excess mortality data, the government has still failed to keep the deaths down.
The Chris Whitty and others would make is actually you need to look at that over a much longer period of time. So we'll have to look back over a year. I'm afraid, not to be evasive, we just won't have that information.
But we only had the data available at the minute, and the available data shows that the government has not been keeping the deaths down in the same way that some other countries have.
So as I say, it is much more complex than you're making it sound, for the simple reason that there are other factors taken into account on excess mortalities, which we won't know about today. For example, what does it do in terms of other illnesses and diseases, and what was the impact of, for example, the fact that we were able, unlike in many other countries, Italy being an example, who have usually a first-class health system, but have found their hospitals completely overloaded, whereas we've managed to maintain critical care space against what everyone thought was likely at the beginning, and ventilators and all the rest of it. So you have to look at the whole picture, and that information simply isn't available as yet. But as scientists point out, there will be a whole range of things that need to be looked at. Obviously, the demographics of the country, age profiles, things like obesity. We know that people in different health categories with underlying problems fare differently in different countries, have different levels of these sort of things. Geography, density of cities like London, for example. So there's a huge amount of different things to look at, and I just caution, as the medical experts do, that we shouldn't look at the raw data and jump to conclusions on this, because actually the NHS has been doing a terrific job, and there will be other deaths outside of coronavirus that may or may not have happened had it been handled differently, without, for example, sufficient hospital capacity.